is a community that has the highest death toll in the city, since the beginning of the pandemic for COVID-related deaths. So, what's your reaction to that? Especially you work so hard to work in the community and find a solution. What's your reaction to just those startling numbers? Over 260 deaths, I think.
It's disheartening. Honestly, that number is disheartening. But we know that Austin is plagued with a lot of different health inequities. So, COVID is not the only one. We have blighted communities that have very limited grocery options, fresh fruit options, healthcare access, right? So there's a lot of different initiatives that our organization is looking to tackle in addition to spread awareness for vaccinations.
I'm still alarmed because after 2 years of work, really engaging in the community, distributing masks and hand sanitizers daily, hosting pop-up events, et cetera, et cetera, et cetera, it's like, really? We're back there again? The mayor has used a term just recently where she's talked about Groundhog Day. And I kind of feel that way as well, that we're back where we started. And I think the lessons learned and the lessons that we've experienced over the past 2 years were not in vain, and that we can reapply some of those learnings.
Our community continues to suffer, and the information is out there. We've done a really good job of addressing the misinformation, but you still have a significant percentage of community members and that still are fearful, still feel like this is something that they're kind of immune to. It won't affect them if it hasn't already affected them by loss of family or significant illness. And so it's incumbent upon community-based organizations like mine and faith organizations to continue to push the envelope of getting information out there and bringing access to vaccinations out there as well. A lot of people, and a lot of people that could potentially have been saved. And it's education is so important. Access is critically important, and the litany of social determinants of health that communities like Auburn, Gresham, Inglewood, Austin, South Shore, you name it, disinvested communities that we have suffered from, really result in the harsh numbers that you just listed. And then some. I mean, we have jobs, lack of jobs in our communities. The violence numbers that continue to be with us these are all results of these long-standing inequities in our communities that are just grounds for disinvestment.
Many of our team members even feared it, and because of the sound bites that they heard from this person and that person, the news this and news that. And so then, I said, okay, well, how can we, again, inform them and then also equip them to better answer questions with folks that they engage on the street?
The thing that I've always tell our team is that the best thing we can be is a resource and a story, letting people know about what our experiences have been with the vaccination, giving them real life possibilities and understanding of what it is to be vaccinated, knowing that you're protecting yourself and protecting your community and protecting your family. So we like to go out and be honest and transparent and give them something real that they can relate to.
You're an Austin resident?
Yes.
Austin native?
Yes.
Are you vaccinated?
Yes.
Okay, so why did you decide to get vaccinated?
I decided to get vaccinated because I wanted to make sure that I was making every effort to protect myself and my family and the community that I love.
South Shore Works is also part of the city's Healthy Chicago Equity Zones, which is part of the Healthy Chicago 2025 plan. And the plan initially focused on vaccinations till the end of this year. But the community, to the end of last year, yes. But the community has said, no, we can't stop now. We're just really getting started. You know, these latest variants are really taking everyone by storm. And so we need to continue on in our work as far as vaccination equity is concerned. And so they heard us, they heard our story, and they said, okay, so they've extended the opportunity for us to do this work until the middle of this year, and then we're going to go back and talk with them again about, you know, have we overcome this, or have we not, or do we need to carry on?
We have an online marketing campaigns that we do. We send out every week with our online subscriptions and neighbors that interact with us virtually. And then we also do canvassing, the neighborhoods, knocking on doors, meeting neighbors, and making sure that they know about the opportunities that are around them.
And so we have to continue to educate, continue to outreach, continue to be there telling the story and addressing the miseducation that has just, you know, permeated our society. And so I believe that gap will continue to shorten, I hope, you know, and we're not going to stop. I mean, we're going to keep. We're doing vaccination events, four or five vaccination events every week. And even if one person comes, that's a success. That's one less person that, you know, well, with this new Omicron variant, I mean, it's spreading so quickly, but that's one less person, I think, whose life will be lost to COVID.